Pfizer is the first COVID vaccine approved in Canada for people under 18. Other manufacturers still have ongoing trials.
We do know that COVID is milder and less frequent in children, but it is not zero. We have had cases, tragically, of young children and teens that have died as a result of COVID-19.
Health Canada says the vaccine blocks transmission of the virus to others and has proven to be safe and 100% effective in trials in which more than 1,000 12 to 15-year-olds from the U.S. were given the vaccine and more than 1,000 were given a placebo.
In the group that did not receive the vaccine, there were 18 cases of COVID-19. And in the group that received the vaccine, there were 0.
Trials for children younger than 12 are ongoing, and vaccines for that age group may be approved in Canada before the end of the year.
It was incredibly effective in children. It was well tolerated in children between the age of 12 to 15. And so it was, eventually going to come. I didn't realize we were going to do it this quickly, but I suspect, the FDA and other organizations are looking at this right now too.
Infectious disease specialist Zane Chagla says it makes sense for kids to be immunized against COVID at school.
It is a great way to reach a captive audience. It's a great way for public health to deal with logistics very quickly, and it will likely help with, herd immunity and getting to the threshold of COVID not circulating.
Ontario expects 65% of adults will be offered a first vaccine by the end of this month. And Health Minister Christine Elliott confirmed today that the province hopes to then start vaccinating younger people.
The plan would be to start the vaccinations in schools, the first dose, and then have the second dose administered before a return to school date in September.
She says teachers have already been prioritized for vaccines, and given the current 4-month waiting period, will necessarily get their second doses and be fully vaccinated before the next school year starts. Lisa Hefner, CHCH News.